you talked about FoxPro, and we're both programmers, probably at a different level. I mean, you programmed an EMR, and I used to make applications within FoxPro. The thing we loved about it is I mean, you could customize the heck out of it. You could make it do exactly what you wanted to. I think this is one of the drivers to the cloud now. Even though they are very, when you get Salesforce, you get Salesforce out of the box, but then you have this Force platform on top of it, and now all of a sudden you can build applications that you can really customize the solution. You can bring in IoT data. You can do a whole bunch of things to it. I think this is one of the new drivers to the cloud that we're seeing is this, and I guess Jonathan Bush also talked about this, that people want to be able to plug in new applications, new thoughts, new things into it. And the cloud is giving us a new way to do that we haven't really had since FoxPro, to be honest. I mean, people give you the EMR and they're like, here it is. If you want something, put in a request, and maybe the vendor will do it, maybe they won't do it. So
Right.
What are your thoughts on that?
Totally correct. So we call this at BIDMC the EHR plus strategy. And what does that mean? So it turns out I have 5 clouds of EHRs, right? So I got an Athena cloud, get an eClinicalWorks cloud, a Meditech cloud, an Epic cloud, some self-built clouds. But they're all FHIR enabled, right? So what we say to this 26-year-old in the garage, you have this beautiful function that doesn't exist in the EHR. And what if we get input data from the transactional system using a JavaScript object notation from the cloud? Can you plumb that? And the usual answer is in a weekend, right? It's like, oh, here's a new OR productivity application. Is Monday good enough for you? And that's literally what we're seeing. As long as you cloud enable your data and your transactional applications with standard Argonaut-based specifications on FHIR, that ecosystem of app developers can just rapidly deploy what you need.